Hi there. If you are listening to this webinar, no doubt you have been thinking about what's happening currently with the COVID-19 coronavirus that has taken literally our world by storm. The following webinar are some thoughts about how we as caregivers may try to take care of ourselves while also taking care of others. This is based in part from my work with Oregon's Disaster Medical Assistance Team, which is one of the groups that is deployed after a national disaster or pandemic. And they are things that are quite translatable to our daily world now as we deal with this unprecedented virus. I thought I'd start with some definitions of what is a disaster. And a disaster is literally defined as a sudden event, such as an accident or a natural catastrophe that causes great damage or loss of life. Some disasters are more predictable than others. So, for example, hurricanes, volcanoes, epidemics are somewhat predictable. The ones that are less predictable are earthquakes, wildfires, or acts of terrorism. Nonetheless, there are some things that we can do not only to prepare for disasters, but also to figure out how to care for ourselves while caring for the people that we are hoping to assist. One of the things that's so difficult about a disaster is that they disrupt the routines of life and certainly fundamentally our sense of security. Whether we see them coming or not, our normal routines are completely changed as we try to adapt to a rapidly changing set of circumstances. And that is no less true with the COVID-19 virus. So, what makes a pandemic? Many of you have seen that the World Health Organization has officially named this particular outbreak a pandemic. A pandemic refers to a global epidemic, one that has spread over several countries or continents after affecting a large number of people. A pandemic is when there's an outbreak that affects much of the world. And we now know that this particular pandemic is affecting all of us, regardless of where we have been in the world or even if we've not traveled at all. All of us are currently at risk. Thought it might be helpful to remind ourselves that this isn't the first time this has happened. This is not intending to be more frightening, but rather to say there has been a long history of pandemics, of course, dating way back to the 1300s with Black Death and cholera in the 1800s, the great flu pandemic of the late 1800s. I remember hearing about that from my great grandparents. And then another cholera pandemic in the early 1900s, followed by another flu pandemic in 1918. In the 50s, the Asian flu was a pandemic we were concerned about. 1968, there was a flu pandemic. And HIV and AIDS at its peak between 2005 and 2012 was considered a pandemic as well. And now we are dealing with COVID-19. This is a chart that takes a look at the continuum of pandemic phases. Currently, we are in the red zone, which means that we're starting to be prepared. Now we are responding, and after this is over, we will recover and try to be prepared for what comes next. You may have heard that one of the things we're trying to do right now, by the very important measures that have been taken statewide and nationally, is to try to flatten this curve. And we're flattening it, hopefully, by taking the extreme steps of closing schools, closing down group gatherings, being much more cautious about hospital and nursing home visitation policies, much more regulation around the food industry. And we're hoping that that will flatten this phase that will ideally result in less loss of life and less exposure or infection. So we know that there are a lot of psychological responses to any kind of a disaster or pandemic, and that is no exception here. It's very, very common to have strong emotional reactions, and it's important for us, even as professional healthcare providers to remember that we too may experience strong emotional reactions, that there's no one right or wrong way to feel. I've heard a number of people say that have chosen to work from home that they're relieved and they feel guilty. They feel like they should be here and they're relieved not to be, in part because of all the unknowns and the fear of carrying risk either to our patients or home to families. In understanding these responses to distressing events, we can better choose ways of coping with our feelings, our thoughts, and behaviors, and try to plan a path to recovery, which is why this webinar is happening. We know that common reactions to disaster are very intense and sometimes unpredictable feelings. We also know that there may be changes to our thoughts and our behaviors. Many of us may feel more anxious than normal, a heightened sensitivity to environmental factors, strained interpersonal relationships. People are often very short fused due to the stress of all of this. And often people experience stress related symptoms, whether those are physical reactions such as a tightened chest or an upset stomach or a stiff shoulders and neck, but also again anxiety or excessive worry. One of the things that I think is so understandable in a time like this is that we have high levels of uncertainty, both professionally and personally, which contribute to the experience of stress. Everything from my child's daycare center is closed and now I have to stay home. You know, how will we manage these new routines? How can I continue to work? And here in the hospital setting, what are the things that we can do to try to protect both our patients and also ourselves during this uncertainty? The COVID-19 pandemic continues to have many, many unknowns, changing practically hourly, which contributes to a heightened sense of fear and anxiety. Fears such as, am I safe to leave home or work? Is it okay to return to work? Fears about being in public, fear that the situation will continue to get worse than it is. And it also can also contribute to a lot of hyper alertness. People say that they're often easily startled as a result of all of this. All of these reactions, by the way, can be acute or they may be delayed after the disaster has been experienced. And sometimes people describe a sense of guilt that I could have done something differently, I should have done something differently, or I should have been there to help. Again, I'm hearing a lot of people talk about their feelings of guilt and confusion. Other reactions, whether they're acute or delayed, can be anger and rage. Life has been disrupted, so people no longer feel safe or in control. And also that sense of isolation that people may feel during a disaster. And in this particular crisis, we're being told to isolate. And so that too has its own set of challenges. But the question may be, you know, those feelings of loneliness and isolation. Am I overreacting? Am I doing worse than other people are? Our families and friends, since we work in healthcare, may not understand some of the distress that we're carrying, or conversely, may look to us to support and reassure them. Other reactions, whether acute or delayed, can be withdrawing or trying to tough it out, and those are not helpful or healthy for any of us for too long a period of time. I happened to be in Puerto Rico after Hurricane Maria, and one of the things that we saw a lot of there was PTSD long after the storm had passed, but people being triggered by seemingly small incidents that would then bring about a sense of PTSD, even though the storm had passed. So one of the things again to do to try to cope with the aftermath of trauma is to be aware and understand what the normal experiences for people can be, and those are crucial in beginning to deal with this event. And again, I want to reassure you that just about any reaction that you may be having is normal. Some of the common physical reactions are nausea or sweating, dizziness, increased heart rate, hyperventilation, sleep disruption, headaches, stomach disruption, or fatigue. Emotionally, People describe that sometimes they can't stop crying or they feel paralyzed by fear or anxiety. Certainly, a great sense of grief, whether it's temporary or long term, grief about how our lifestyle has changed, grief about how unsafe we suddenly feel. In other extreme cases, grief following the illness or death of loved ones. People often, as I mentioned, feel lost or isolated in some of these feelings and may respond to such by withdrawing. Others may feel angry or irritable. For many people, a sense of numbness or just simply being overwhelmed. And all of these experiences can happen either individually or collectively or intermittently, over the course of the day. Cognitively, a lot of people describe impaired thinking or difficulty in making decisions. They may feel distracted or have short term memory problems. Sometimes people describe having intrusive thoughts or flashbacks and memories of not only this disaster, but perhaps previous ones as well. Poor attention and forgetfulness. Some of the things that put us at risk as professional helpers is the desire to help others while also managing our own stress reactions and fears. I know in my role that I'm getting almost hourly updates on the COVID-19 virus, and sometimes I just have to take a break because my head is so full of all the information that is continuing to change. The other is the need to carry on despite our own stress and the possible need to hide or repress our own reactions because we are the professional helpers and we may feel like we can't afford to show that to anyone else. And there's also an internal misconception or belief that we should be tough enough to handle this. In my work with our disaster response team, my role is twofold. One is to try to help the people who have lived through the disaster, and the other is to be what they call force protection, which is to keep an eye on our overworked, exhausted first responders who may feel like they should have the ability to just tough it out despite very, very long work hours and physical exhaustion. And so my role is to keep an eye on that and identify who might be in trouble and to take a break. I think one of the ways to do that and to take care of ourselves while caring for others is to acknowledge that we too are human. Our reactions are normal to events that are anything but normal. It's really critical to be kind to ourselves and to others. Everyone is stressed, even if they don't look like they are. And we may not feel like we're doing our best clinical work. That is understandable and it's okay. We're all just trying to survive. One of the most critical factors is to be self aware. What are your thoughts? What are your feelings, spoken or unspoken? What are you afraid of? Are you more anxious or irritable? And how are you managing that? Some of the most critical things to be mindful of are your own basic self care, such as sleep, food, physical exercise, to try to stay as healthy as you possibly can and keep your immune system as strong as is possible. Another one is to maintain our connections. Now, ironically enough, with this particular outbreak, we are being told to isolate, to stay out of public places, to maybe not go to our places of worship, and to really stay away from others. But even having said that, it's so important that we maintain our connections with one another, be that our close family member or our friends. Fortunately, in this particular era, we have a lot of ways of staying connected through our iPhones or emails or other ways of connecting through technology. The other thing that can be so important is to notice the wins. What are the meaningful experiences that are happening during all of this? What are some of the things that are helpful? Did you notice something went well? Did certain things go into place quickly in a way that was meaningful? And certainly trying to interrupt your worrying. One of the things that just fuels anxiety is to be either ruminating about the past or very stressed out and worrying about the future. Both of those take us out of the moment, and that excessive worrying is not good for us, particularly if we are worrying about things that we may not have any particular control over, and worried about the unknown and things that we don't have any information about. Now, being proactive and being planful can be very, very helpful, but excessive worrying may not. Another thing that we know as human beings is that we are resilient. And ironically, we have to be exposed to difficulty in order to develop resilience above and beyond the inherent resilience that we are born with. Quite literally, the definition of resilience is the ability to bounce back. And it's something that happens in the process of adapting well in the face of trauma, tragedy, threats, or other significant sources of stress. But being resilient does not mean that a person doesn't experience difficulty or distress. Resilience is something that we cultivate over time and sometimes aren't even aware of until we're on the other side of the difficult situation. Emotional steadiness is the ability to be present without becoming overly involved or emotionally detached in a stressful situation. Dr. Sydney I, a psychologist with our OHSU's wellness program, acknowledges that this definition fits our strengths. What we offer as healthcare professionals to be engaged, to be caring, and steady in critical patient care situations. Again, emotional steadiness, being present without becoming overly involved or emotionally detached in a stressful situation. The road to resilience is likely to involve considerable emotional distress. It involves behaviors, thoughts, and actions that can be learned and developed by anyone. Some factors in resilience are caring and supportive relationships. Again, with your family, with your close friends, with your teammates, with your colleagues. That can absolutely foster and support resilience. The ability to work together, even if we don't always see eye to eye, is a really critical step in getting through a critical situation. The capacity to make realistic plans and take steps to carry them out. Again, that's part of being proactive, not only professionally, but personally. Other factors in resilience are a positive view of yourself and confidence in your abilities to get through this, skills in communication and problem solving, and the capacity to manage strong feelings and impulses. All of these factors can be developed, each and every one of them. The key is to identify ways that are likely to work well for you as part of your own personal strategy for fostering resilience. You may want to think about how do you generally cope with stress, and what might you want to add in to be sure that you can get through a time like this. I know for myself, continuing a meditation practice and exercise are pretty critical to staying centered and grounded during such a difficult time as the one that we're living in right now. Other things that help in terms of personal assets of professional helpers, an ability to tolerate uncertainty. Certainly, those of us who work in acute care know that things don't always go the way that we've planned, but in the context of a disaster or a pandemic, it's even more critical to develop a tolerance for the uncertainty. Our desire to help others are very, very helpful, and the ability to be a team player versus the hero. You see in places where teamwork is essential are places like the military, our disaster teams, all of those really, the operating room, different places that we talk about how teamwork is essential, but we know in times of war, in times of disaster, teamwork is critical versus having one person be the hero. Other things like strong leadership can really, really help as well. Reasonable physical fitness, because this is a marathon, not a sprint. So making sure that we maintain our stamina and continue to reinforce that through those basic needs like sleep, food, and exercise can be really important. An ability to improvise, that is hugely important in a time of disaster and unknown and unpredictability. Certainly having a sense of humor helps. It helps tremendously in helping us defuse some of the uncertainty and the distress. And then a sense of patience, patience with ourselves, patience with others, and patience with our systems, which may not respond as quickly as we would like them to, and staying flexible. All of these are things that can help us during a time of such duress. Other ideas are to limit your exposure to the news, screen time, and your phones. During a time like this, many of us are grabbing our phones to see what the latest update is, but I think it's critically important to take breaks from that and limit your exposure. It's also important to continue to do the things you enjoy, whether that's to take a walk outside on a beautiful day, to spend some time in your garden, to be with your pets, whatever that is that brings you some enjoyment, and trying to maintain some of your routines. That can help steady us and ground us when things are so unpredictable. Try to use meditation, mindfulness, or relaxation techniques if that's something that you're familiar with. There are lots of apps these days. Insight Timer and Calm are a couple of the apps you can put on your phone that will teach you relaxation techniques that only take about 10 minutes a day that can be very helpful. And other techniques that we refer to as grounding techniques in the counseling field, such as checking your breath. When we're distressed, we typically breathe very shallowly. Our heart rate goes up, we have a push of cortisol or adrenaline, and we breathe very shallowly. So check your breath and take 2 or 3 deep breaths every time that you check them to see how you are doing and to make sure that you ground yourself. There's another technique called tapping, which you can just take 2 fingers of each hand and tap on your chest, right to left. That too, believe it or not, can offer a sense of calm when you're feeling particularly anxious. Seek professional help if you notice persistent feelings of distress or hopelessness or experience post-traumatic stress symptoms. If you feel like you're barely able to get through your daily responsibilities and activities. In addition to OHSU's wellness program, the EAP is something that is available to all of our employees at OHSU, and there are a lot of mental health professionals as well who are available to help. Interestingly, disasters often bring people together. You may remember that from Hurricane Sandy, the tsunami, September 11th, way back in 1906, the San Francisco fire led to an outpouring of support and communities coming together. Remarkably, acute stress may lead to greater cooperative, social, and friendly behavior. I've been hearing several examples of neighborhoods reaching out to their neighbors who may be more isolated or may be already ill or on self quarantine, offers to bring food, offers to walk dogs. All those kinds of things can be pretty remarkable. And you see sometimes incredible acts of heroism as well. We also, as much as we don't want you to be a hero, we can certainly point to examples of quiet heroism that are happening every single day. We want to be a team and work as a community. Social connections, as I mentioned, are particularly important because stress leads us to a sense of vulnerability and loss of control. And if we can remember that we're in this together, that can be immensely helpful. We also know that one of the reasons that stress brings, in disasters, brings people together is it's a reminder of our own mortality. And that can often lead to a greater sense of generosity and helpfulness. Vulnerability is the core ingredient of social bonding, according to social worker Brene Brown. And acute stress reminds us of our common humanity and common vulnerabilities as well. We're doing this together. Through history, people have bonded through difficulty and displayed kindness, heroism, and social connection as a way to survive and thrive. And again, we are a sense of community, and we can do that together here at OHSU and in our communities, in our neighborhoods, and all of the other communities that we're a part of. Some gentle reminders, be gentle with yourself. Give yourself the grace to be human. I talked to a couple of my staff members today about their guilt about what they're not doing. And yet, what they are doing is trying to protect our patients, trying to protect their children and families. We are human too, and we are capable of both feeling frightened as well as feeling strong. So allow yourself to be vulnerable and experience a range of thoughts and feelings, and remember that you're resilient. In time, we will have perspective. In time, we will understand what this COVID-19 is all about, and we will learn some lessons. We will gather perspective, and we will have insights. But those rarely come all at once. It will take time. But again, we are better together. And it's really important to heed the lesson from air travel, which is put your oxygen mask on first before trying to help others. Take care of yourself through your physical health and well being and your emotional health and well being so that we then can be better prepared to help others. Thank you for all you are doing to support our patients, their loved ones, and one another during this unprecedented time.